The winner of Best Institutional Architecture Award from Berg, Singapore, Redbridge International Academy is the proud host of a huge campus that is spread across a lush green environment. A refreshing view to wake up to or to walk into, Redbridge is a campus that helps its students reconnect with nature. The refreshing and scenic atmosphere is rejuvenating for the mind and body, making education a whole new experience for the students. Redbridge has a state-of-the-art infrastructure, a biodiversity park, a combination of wide open spaces, abstract designs on colourful walls, well-ventilated classrooms with smart boards, and fully equipped science labs. The school has a library, a robotics room, math labs, and computer labs, available for all students from primary to high school.
When I first came into the school, I loved the infrastructure and there's a lot of greenery.
The school has dedicated spaces for learning music, dance, drama and art. This makes every day at Redbridge an enriched experience for the students. The school emphasizes on academic rigor and excellence in mainstream subjects, specifically English, math, science and computers, along with co-curricular activities. The spacious campus has professional indoor and outdoor facilities for all major sports and co-curricular activities, including facilities for athletics, football, cricket, basketball, badminton, tennis, table tennis, handball, throwball, karate, yoga, skating, billiards and squash. Swimming and horse riding are outsourced. The students develop a passionate attitude and have a healthy, cheerful personality essential to succeed in life. Redbridge has embarked on an innovative educational mission that is truly the defining factor in shaping our students for a successful career. Conventional education is transactional, while the education at Redbridge is transformational. Students, irrespective of their academic background, are transformed in their minds and bodies as they evolve in rigorous academic as well as co-curricular learning. Students have the option to choose from a wide variety of subject areas with a choice of different curriculum and qualifications. Academic focus instills in them self-discipline, good communication, critical thinking skills, and a smart intellectual disposition.
Redbridge campus is very beautiful. I like art, dance, music, pottery, lots of activities and co-curricular activities.
The sport activities ensure that the responsibility of learning shifts from the teacher to the students, thereby making learning self-directed, student-centric, and personalized. A balance of creative assessment in academic and sports facilitate group dynamics, decision-making abilities, problem-solving skills, resilience, mental fitness, and promote the overall well-being of the child. At Redbridge, every individual can truly empower and inspire one another to fulfill the mission of the school in a more enjoyable manner, thus overcoming all challenges to face the dawn of tomorrow.
With the mission to create well-rounded world citizens who will strive to stride ahead and reach beyond, Redbridge aspires to mold its students to unlock their talents, skill sets and competencies by the application of shared knowledge and teamwork. Redbridge International Academy is different in many ways, but what sets us apart from everyone is our inclusive education department. Children from all backgrounds, irrespective of their abilities or their disabilities, are welcome here, keeping in mind what they can do rather than what they can't. We focus on more of their abilities and their strengths rather than their disabilities and what they can't do. We use more hands-on activities. We are more open to what the child needs rather than what we need from the child.
We teach our students to break barriers of limited thinking, to see beyond the horizon, to understand people and their world better, in order to develop a foresight with which to view the uncertain future. At Redbridge, we believe in converting a student's dreams into reality and making our world a better place to live in. Holistic child development is the main focus of the school. We work on developing and nurturing the 5 personalities of a child: aesthetic, cognitive, physical, emotional, and spiritual.
In Redbridge International Academy, while we never lose sight of the fact that our students are the center of our mission and purpose, we never fail at every stage to inculcate in them values that are so essential to living a wholesome and fruitful life, in perfect harmony with themselves, but also with others and the world around them. Virtues of love, brotherhood, cooperation, loyalty, honesty, caring, sharing, and compassion are instilled in them the moment they enter the portals of this institution.
Redbridge prepares its students to face the real world and prepares them to take on challenges in an ever-evolving competitive society. Redbridge is an institute that is caring, principled, innovative, and strives to shape the future of the younger generation.
We are going to produce an engineer who will be an expert sports person. We will be producing an astronomer who will be excellent classical musician. So we have a mix and match of different disciplines which are taught to the students as part of the whole education program. So we will have students developing a balanced personality with a good head and a good heart, with skillful hands.
Redbridge is the proud recipient of various prestigious awards in the realm of education, offered by reputed international institutes and educational bodies. These accolades include awards for its innovative architecture, individual attention to students, co-curricular activities, and for excellence in STEAM education. The school has also been ranked as one of the top international schools in India.
Coming into Redbridge, the first thing that stood out was our principal, who welcomed us with such cheer that it gave me positive vibes for the whole year ahead. One of the greatest things about this school is that the students are so close to each other and that the teachers are extremely involved with the students.
Catering to a spectrum of students and faculty from across the world, Redbridge is a place where learning is personalized, with the students and the faculty collaborating in a constructive and cohesive environment to facilitate a wide range of transdisciplinary, inquiry-based and experiential learning. The school focuses on helping the students nurture their talent, unlock their self-awareness and ensure holistic personal development. Efforts are taken to ensure minimum attrition of teachers and students. Concerted efforts at educational excellence, ethos and philosophy make Redbridge one of the best international schools in India.
We are looking at a capacity building wherein we will bring in the best of talent within the market and outside the market. Teachers, administrators and students from all walks of life and society.
Have you ever wondered what counts for a holistic, all-round development of your child? A healthy environment after school is quintessential for your child's well-being. At Redbridge, we ensure that your child is a happy dreamer, by providing a comfortable environment that allows the boarders the right balance of controlled freedom, enriching campus, and equal opportunity. The school has excellent residential.
Wow, that's our vibrant Redbridge International Academy. Parents, teachers, children, well-wishers, welcome to the second in the series of community outreach webinars organized by the Redbridge International Academy. Last month, we had a well-received webinar on homestay issues in children during the pandemic from key speaker, Mrs. Namrata Navalkar, the renowned psychotherapist and counselor from Bangalore. We are back this month, more inspired than ever, to host this second webinar titled COVID in Children, Curiosity Answered, with key speaker, the renowned Dr. Manu Chaudhary, Fellow of the American Academy of Pediatrics, the American Board Certified Pediatric Infectious Disease Specialist, and winner of several national and international awards for her work in medicine. Welcome, Dr. Chaudhary. Redbridge inculcates community outreach even with the school's children in all the curricula, be it ICSE, Cambridge, IGCSE, or IBDP, the Rahi Rise Against Hunger India initiative being one of them. Currently, Redbridge International Academy has the Dawnathon initiative in full swing. It's the Bridge the Gap between the privileged and the underprivileged initiative in which you can also be a contributor. Do check out the school website for further details. And now I invite the young and dynamic chairman of Redbridge International Academy, Mr. Rohan Agarwal, to set the context for today's webinar. Over to you, sir.
Thank you, Mr. Raghavendra. A very warm good evening to everyone attending this webinar being organized by Redbridge International Academy. We are one of the leading institutions in Bangalore and India. For the benefit of our guests who have tuned in this evening and are not yet a part of the Redbridge family, I'll just give a quick and short introduction about the school. Redbridge has an expansive green campus and is located very close to Electronic City. The large, naturally ventilated classrooms with small student-teacher ratio aids the teachers to focus on individualized learning and holistic development of the children. Redbridge offers a choice of both international and national syllabus and strongly believes in the interdisciplinary approach of teaching. We have an inclusive education policy and inculcate good values to students. Our focus at the school has always been about making the experience better for all the stakeholders involved. And after the first successful webinar on mental health, the team at Redbridge were pondering over what should follow. That brings me to the topic of this evening. Let's go back in time to over a year ago, when the reports of the first few cases of corona started trickling in. We were all anxious and petrified of the deadly coronavirus and what was to follow. Then we started to learn a little bit more, and then a little bit more. This made most of us a little lax about the entire pandemic. But we were extremely lucky that in the first wave, our children were not getting affected. Perhaps they were latent carriers, but the kids themselves were safe from the infection. During the second wave, the virus mutated and the variants became deadly. Society's casual attitude towards the pandemic did not help. And this made our worst fears come true. A large number of children started testing positive for COVID-19. The children over the last year have been facing the brunt of the pandemic. No sports, no games, no school, no outings, no holidays, and most importantly, no friends. If I can simply put it, our beloved children have been velcroed to their homes, and their wonderful therapeutic smiles are lost and hidden behind their masks. There have been a sharp jump in the number of children and adolescents in Karnataka and in the country as a whole testing positive for COVID-19 during the second wave of infections. This has obviously rattled and shaken all of us. I understand that 40,000 children aged below 9 and over 1 lakh children aged between 10 and 19 years have tested positive in the 2 months from March to May this year only in Karnataka. This is a sharp increase from what we observed prior to March 2021. The infection among children is spreading fast, and we are anxious to know about multiple factors such as what are the SOPs that are to be followed? What are the symptoms to look out for? Which vitals should I monitor? Is an RT-PCR COVID test recommended for children? Can the child be treated at home or needs to be moved to the hospital? What are the symptoms which manifest in kids and adolescents? What are the SOPs in case the symptoms show up? Should I be panicking? These are only some of the concerns that we have. Apart from these, we also have a multiple voids in our heads about times to come, such as what are the long-term implications and impact on children, the impeding third wave and the effect on the same on our children, development and rollout of vaccines for children, and the overall impact of the vaccine, and so many more. This webinar, along with our expert speaker, Dr. Manu Chaudhary, who is a pediatrician and children's infectious disease specialist at the Rainbow Hospital, Bangalore, attempts to address some of these concerns. It is extremely comforting and reassuring to see the decrease in the number of cases in our country. Perhaps we can start looking ahead with a renewed confidence that we are on our way to defeating this virus. Of course, this is going to take a while, and the battle is still very much on. But it does herald a more benign period ahead and gives us immense hope. The only way our children can be safe outside is if the number of cases drop down significantly. All the adults who have joined in for the meeting today, I would like all of you to take an oath to not step outside unnecessarily and help to stop the spread of this virus. The sooner the virus stops spreading, the sooner our beloved children can get back to their schools, their games, and to their friends. I would like to thank everyone on behalf of Redbridge International Academy for joining this webinar. I now hand it back over to Mr. Raghavendra to introduce the next speaker for the evening. Thank you.
Thank you, sir, for setting the context, laying out some of the facts for us about how the pandemic is affecting children, and also being very hopeful for the future of these, the future of our country. Thank you very much, sir. And now I'd like to invite the inimitable captain of the ship that we call Redbridge International Academy, our beloved principal, Mr. Christopher Anthony Brown, to speak to the audience and set the context.
Good evening, friends. Revealing one's age is most often than not frowned upon, particularly by the fairer sex. However, turning older is part of life, and from my own experience, becoming a senior citizen is really not bad at all. Apart from the courtesies extended and the enhanced levels of love and respect, and the other perks one enjoys, from a wheelchair and a buggy at the bus, train, and air terminal, to a separate priority queue and other privileges and concessions, social and financial. Post 60 is quite welcome indeed. So it was really not surprising, come the pandemic and the second wave, caused by the now rechristened Alpha, Beta, Gamma, and Delta variants of COVID-19. Senior citizens like me again became the privileged lot. We were given monetary concessions and pushed right up in the order of preference to seamlessly receive either the Covaxin or the Covishield vaccines. And to our luck, the two doses at that time recommended just 4 weeks apart. So many folk like me, after receiving our 2 doses, are a lot more comfortable, at least in mind, in the knowledge that our antibodies are on full alert, on guard, and ready to fight the good fight against this unseen monster called the coronavirus. Over the last month, the 18+ category of citizens have begun to receive their jabs as well, albeit at a reduced rate, but at a higher price, caused by either a depleting stock of the vaccines or the millions in the ever lengthening wait list. Fact or fiction, and be that as it may, fortunately, the levels of infections caused by the second wave have over the last few weeks shown a steady decrease, and so has the rate of mortality. The concern, however, is when will all people in this 18+ group receive both their doses? And of course, the million-dollar question, when will the under 18s and our children too get some assured form of protection, either in the form of a vaccine or otherwise? Because of the stringent measures taken by the administration after the unprecedented shock and magnitude of the second wave, we are back to wearing masks more diligently and being socially more responsible in our behavior. Testing is happening on a war footing, and with the imposition of restrictions in many districts, it has made it difficult for the virus to spread as it did earlier. But let me hasten to caution all of you. If we begin to reverse this process, the situation can once again become unacceptable. The virus can certainly strike again if people become carefree, like they did earlier this year. And we may be inviting the third wave, which will have a more devastating effect for all of us. At this point, I would like to recall the reflections of the famous author, Mr. Salman Rushdie, when he recently wrote in his diary after interacting with his graduate students, and I quote, "I have been teaching a little bit virtually, online in the spring semester. And one of the books that I got my graduating students to read was Daniel Defoe's Journal of the Plague Year, which was about the Great Plague of London in 1665. One of the things that strike you every page of the book is how the way the people behaved in the 17th century is exactly the same in which they behave now. There were some people who behaved really well, locked down and sequestered themselves, and in many cases survived. There were other people that refused to do that. They said it was an intrusion on their freedom, and many of them unfortunately died. And there were all kinds of quacks peddling crazy cures, and there was falsification of the official statistics. And it just showed me that we are just who we are. Human nature is what it is. And back in 1665, people were doing exactly what people have been doing during this plague year. I don't know whether that is comforting or not, but it definitely seems to me, as a species, we humans have not grown up very much since the 17th century, unquote. My friends, when the peak is declining and we suddenly get back into the same irresponsible behavior as a society, like we did in January and February 2021, the virus can come back. And God help us if it's in, or if it is caused by the epsilon, zeta, eta, theta variant of the coronavirus that we are not prepared for. Well, we'll be in deep, deep trouble. The severity of the third wave will be determined by the way the people follow COVID-appropriate behavior. The greater and more widespread the violation of the norms, the steeper will the infection curve become again. However, if we ease the restrictions gradually, adjust our behavior, the next wave won't be that bad. Or it may not happen at all. People need to ensure and show discipline so that India has enough time to vaccinate the maximum number of citizens as possible. Because our children and adolescents up to the age of 18 have not as yet been covered by the vaccination program. There has been a lot of hype and talk in the media, especially in the recent weeks, of what is being called the child wave that is supposedly coming. But all scientific evidence from the COVID-19 pandemic suggests that in all the waves, children in the age group of 0 to 18 have been at relatively low risk of developing the disease. Yet, contrary to all this evidence, both social and mainstream media are abuzz about how children are either already getting severely affected or likely to get severe disease in the third wave. But available data clearly indicates that amongst the hospitalized COVID-19 cases in India, in both the waves, only 2 to 5% were from the 0 to 18 age group. there is no evidence from any part of the world that a third or any subsequent wave will affect children disproportionately. What we need to understand is that a majority of children who required hospitalization for COVID-19 already had some underlying problem, and that many of them would have been hospitalized even if the pandemic never happened. However, all this talk is creating panic among parents, especially since their children are unvaccinated. India's COVID-19 pandemic response continues to be influenced more by opinion than by scientific evidence. To win against the pandemic, the administration needs to pay attention to scientifically sound advice and not get swayed by the noise. They should stay focused on preparing for the future, developing a detailed roadmap to strengthen the health system and to prepare for a subsequent wave. Most importantly, even if there is no evidence to conclude that children will be more affected, we should still prepare for the worst by increasing COVID-19 ICUs for children. What we need to remember is that the adult population continues to be at a higher risk than our children. And this is precisely the reason why we invited in our midst Dr. Manu Chaudhary, MD, who is an expert in pediatric infectious diseases. He is going to help us discern the fact from the fiction, the truth from the misinformation, the signs and the consequences, the needs and the requirements, the do's and the don'ts, so that our parents will feel more reassured and prepared. After listening to her, after getting their concerns clarified and their questions answered, and of course, listening to her advice, we so look forward to your guidance, Dr. Manu Chaudhary. Thank you for your time. And ladies and gentlemen, for your patient hearing. Good evening once again. Take care. Stay safe. God bless you.
We are always so blessed, sir, to listen to you. You always leave us with so much to think about, so much food for thought. And it was very interesting that you took us on a time journey, this day, that century, to the times of plague, and you mentioned about human nature. Very interesting, something for us to think about. And I'm sure we have gems to take out of what you said as well. So we will do that along with what Dr. Manu Chaudhary will advise us to do. So let's go ahead now, and I'll introduce you to our key speaker. Dr. Manu Chaudhary, MBBS, MD, is an American board certified pediatric infectious disease specialist and fellow of the American Academy of Pediatrics. After completing her MBBS from AFMC, Armed Forces Medical College, Pune, she pursued her residency and fellowship from the USA. Her externships were at Harvard Medical College and Mount Sinai School of Medicine. She gained expertise in most sophisticated and contemporary diagnostic methods and therapeutic modalities to assist in the care of healthy children with life-threatening to common infections, as well as those immunocompromised patients, including hemato-oncology, solid organ and bone marrow transplant, neonatal and pediatric critical care patients, as well as with complex infectious diseases. Her outpatient training included general infectious diseases follow-up for inpatients, referrals from pediatricians, and specialty chemical clinics for TB, for travel, for HIV. And she specializes in infection control and prevention and antimicrobial stewardship as well. Well, here is a first. She's the only USA-trained pediatric infectious diseases physician in Karnataka and among the very few in the country. And she is the need of the hour, as you and I know. Well, here's a few accolades that I'd like to mention. She's the recipient of Early Career Award, which came with $25,000 prize money as well from Thrasher Research Fund, and only 15 out of 120 applicants are funded worldwide for this. And this was also an initiative by the Indian Council of Medical Research. She has published and presented first author original research work nationally and internationally as well. Her research of prolonged fever in Indian children was awarded in 2019 at the 2019 annual conference of the World Society of Pediatric Infectious Diseases. Ladies and gentlemen, Dr. Manu Chaudhary.
Thank you so much. Thank you so much for such kind words. I am very obliged and I'm very excited to be here today. Throughout this 1.5 years, my whole concentration has been managing these patients in the hospital in OPD, as well as, addressing the parents across the country to make sure they get the right information. So thank you so much for inviting me, Mr. Rohan. Thank you for kind words, Mr. Christopher. What I thought of is I'll start talking about very simple things, which I feel as a physician, I want to share with everybody, and then I'll start taking questions. So by now, coronaviruses are not uncommon or unheard of in this world of infectious diseases. We've had a lot of, summer coronaviruses, winter coronaviruses. We had some epidemics in the past which were related to coronavirus, like the SARS coronavirus and then the Middle Eastern, again, both of them in the Middle East part of the world. But we were able to control it pretty well. Whereas this virus has spread like fire across the world. Now with all the research and, second year into the pandemic, we are quite sure of some things. Some of them being, how does it spread? So it spreads through droplets. There was a lot of concern about fomites where, we were cleaning even our pastas, our vegetables with soap, all those, lot of concern in that regard. At least that has been put behind. So now we know the virus spreads through droplets. What are droplets? They are small particles where the virus gets collected when somebody infected or is carrying the virus, sneezes or coughs. And this droplet can just travel 1 meter distance, okay? So that's why, and that is the reason for all these COVID appropriate behavior we all are talking about. So a good mask, properly worn, a social distance of at least 1 meter, and then of course hand hygiene. So suppose somebody sneezed and the organism is still live in that area and somebody touches it and touches their nose or face, then it can go. So hand hygiene. So those are the 3 most important COVID appropriate behavior which we need to follow up. So no need to obsessively start, clean the surfaces unless you have somebody who has COVID at home and who's isolated. So there you have to even take care of the cleaning aspect of things. Reason for second wave, I think Mr. Rohan had already alluded to it, and I just want to add to it. There was a lot of laxity of COVID appropriate behavior. So there were a lot of gathering, there were a lot of marriages happening, children being accompanied with their family members, teenagers getting back together. It's so normal behavior to, meet your friends without mask because our numbers look beautiful after the first wave. So that was one of the causes. The second cause was the variant of concern. So now we have the name Delta for our variant, then we had UK variant. So the transmissibility of these variants is very, very high. So the current variant we have is almost 60 to 70% higher transmissibility. So we heard people, initially when we were seeing a pediatric patient coming in, it would be just one odd family member getting affected. But now it's the whole family. One person gets it and then everybody gets it. So the transmissibility of the virus is very, very high. And the reason these variants become variants of concern is because of that. Which one has higher chances of surviving and spreading. So that's what we saw. What happened to children in second wave? So this, I would share my own experience. So Rainbow Children's Hospital is a dedicated pediatric hospital. We have multiple branches across the country. It's the only pediatric hospital dedicated just for children. So we have 200 bedded hospital. We had in the last 2.5 months, we had around 1,000 video consultations for COVID. It was just dedicated to COVID patients, most of them being managed at home. So that's a very good number. So as Mr. Christopher said, most of our children had mild infection, which was managed at home. Approximately 200 children were admitted in the hospital, and less than 10% of them required ICU care. In those patients who needed hospitalization, the reasons were fever lasting little longer than as we expected in our first wave, the child unable to control the fever with oral medications, children not maintaining oral hydration. So they're not feeling well, just like how adults get fatigue. They were feeling very lazy, not up to the beat. They probably also had, altered taste and smell. And that's why the hydration was a concern. So that was the second reason they were getting admitted. Third was some of these children had other infections along with COVID. So they might have a urine tract infection. With the rains coming in, we had some dengue, with the COVID, so some overlapping infection. We did see even simple, kids who did not have any underlying disease getting admitted, which is very well known for any viral infection. So nothing out of the ordinary. In our ICU, very, very few patients, I can tell you like 5 to 6 maximum of all those 200 required need for oxygenation through ventilator. What we say, we put a tube and then make them breathe. There was no mortality. There was nobody died in our center and across our centers with COVID in children. And that is a beautiful, reassuring fact for all the parents, because I want to share the real life data with you guys. I feel the television and the news, they at some point they're just trying to increase their TRPs by making unnecessarily concerning comments. So here's what I felt, and I wanted to share this number with you guys. Right now, the number of even children getting COVID has definitely went down. What else I wanted to make every parent here aware is something called multi-system inflammatory syndrome due to COVID, MISC. It's also called PIMS, so Pediatric Inflammatory Multisystem involvement due to COVID. So what it basically means is a child had COVID infection in the past, developed antibodies, and your body starts reacting to those antibodies. So instead of being happy and ensuring that next time we get exposure, these antibodies are creating issue in the body. Again, the number of children who get this condition is very, very low. And usually we see these cases now. So you have your big wave. Once your wave is gone, that's when we start seeing these patients, MISC. And you'll probably hear this in the news. You'll probably read it in the newspaper. How do we find out, and when does it really happen? So usually it happens anywhere from 2 to 4 weeks after their acute symptoms of COVID. They might even be asymptomatic. So all the family members got it. The child was asymptomatic, but of course was exposed. Subclinical infection didn't really cause any problem at that time, but the antibodies developed 2 to 4 weeks later, and up till 3 to 6 months, mostly within 6 weeks is when we are seeing this presentation. And the presentations include your child will start having fevers, okay? They'll have fever with red eyes or red lips. They'll have fever which is lasting longer with vomiting or loose stool. They'll have fever lasting more than a couple of days with rashes. So the reason I'm telling this is because parents get really worried after hearing it. So even little bit of rash here and there because of the season change, because of the dry skin, please don't panic. The underlying problem which should be there should be a consistent history of fever, which is, and most of the time it's high grade fevers. It's not a normal 199 temperatures. Also, you should know how to take temperatures, because that I have been consistently with being an infectious disease doctor. Parents don't know exactly what to call fever. So any temperature underarm above 99 is called fever. Any temperature through scanner, mouth or ear thermometer more than 100 is called fever. Please do not add +1 to the underarm. Just don't do it. Above 99, it's fever. So if your child is consistently having these temperatures, just reach out to your doctor, your child's doctor, and they'll let you know. So usually what we do is we'll ask our patient's parents to make a video consultation. We'll speak to the parent, we'll see how the child is looking, and then we call them in the hospital if we really feel that we need to see the patient. Any child having fever beyond 3 days definitely needs to be seen by a doctor and find out. Maybe we'll do some blood investigations or whatever other investigations, checking for urine infection or COVID or MISC, and that would be again a decision of your doctor. There are a lot of unnecessary investigations are being done from some of these physicians. They based on what we are seeing in adults, they do these unnecessary investigations like D-dimer and all, which really do not reciprocate for children. So again, if any concern in your children, you can reach out to your doctor and they should be able to help you. Okay. So this is what the MISC part of the situation is. So we are currently, instead of acute COVID, we are seeing more of these conditions. Very few children in our ICU required any particular complicated medications which are not available. So fortunately, our parents didn't have to rush around to procure some of the medications. How unfortunately our adult family members for adult patients were searching out. So no such issues that were going on in this second wave. We will see high numbers of children, right? Because there was so much spread in the community. So of course the numbers in children will be higher because they are going to spread. They are staying at home with these elderlies. 75% of my patients who were COVID positive had a family member, adult family member, who gave the infection to the child. So again, it's coming. Speculations regarding third wave, I think that's a big, I think media has made it like a dramatic concern. as an ID physician and experiences across the world, I don't think COVID third wave for children will be any different from what we have seen. Actually, it will probably be way lesser than what we saw in second wave. First, any pandemic does not disappear. It is going to have its wave. It's not like we're not going to see a third wave or it's just going to vanish. Every pandemic, epidemiologically, if you see previous pandemics and what we are seeing in Western world, they're seeing their third wave, fourth wave, fifth wave, and that's when, and it probably will become like a yearly event, like how we see influenza, flu. So we are going to see, but it's definitely going to be a better wave. The children are still going to be very similar presentation, what we see. So 90% of them going to be very mild infection, can be managed at home. Some of them might require hospitalization, and very, very few will require ICU support, and the mortality will again be negligible. So please don't be too over concerned. Of course, you have to be aware of what are the symptoms. Most of my patients who came with COVID, the commonest complaint was fever. So they can have fever without cough, cold, vomiting, loose stool. It can just be fever. COVID can present just with fever. So when our child walks into my emergency room or my clinic with fever, we're checking it for COVID. They can have runny nose, cough, congestion, because it's a virus which affects our upper airway. They can have cough which is lasting long, so that is probably affecting their lung. Measuring oxygen level in younger children. Really, the pulse oximeter is not really great, because it's what we use in the hospital is usually we strap it like a bracelet, and that's how we need oxygen level. So if you have a young child who's moving around, the oxygen level can come as low as 79, 80, and parents really get worried that, oh, it's the oxygen level. If your child is running around, nose is not flaring up, not coughing all the time, not coughing after, cough, and vomiting food, they're probably doing okay. They have to be stable. So what I usually tell parents is, if you really want to check oxygen, just let them sleep. And when they're sleeping, you can check. But you have to focus more, and the pulse rate should be regular to really tell you what is the oxygen level. And if they are really tiny fingers, these oximeters are not going to help you. So the other signs to pick up on is if their nose are flaring, if their chest is going in and out. So those are the signs for, where the lung might be involved and you need to see a doctor earlier than later. They are also presenting with vomiting, loose stool. They can develop some rashes. They can have stomach pain complaints. So all vague complaints, sore throat, change in smell. If they are adolescent, they'll tell us that they have altered taste. And so all these various symptomatology, they can be presenting. So watch out for them, reach out to your physician, child's physician, and take their advice as in. There is no role of all the, spectrum of medications that are being prescribed to our adults. Ivermectin has no role, doxycycline has no role. Any antibiotic has no role in COVID. It's a viral infection. You do not need an antibiotic. So there's no role unless there is evidence there is a co-infection because of bacteria. Then only we should be using antibiotic. So please do not expose your child for unnecessary medications, because they'll just impact their good antimicrobials in their stomach. So again, if your child's pediatrician is giving, question them. Why? This is a virus. Why are we giving antibiotic? You have access to internet. So read about what medications are being prescribed to your child. And if you have any question, please ask the doctor, what is the reason behind it to be prescribing that medication. Unnecessary use of CT scans. So, oh my God, so many are my patients, adolescent patients referred from various centers were unnecessarily exposed to CT scan. So CT scan is, we've hardly used this for our children, because you can pick up their respiratory problem, their breathing issues just by examining them well, and we very well can start with the x-ray and decide how to go about things. Very few instances we get CT scans. I know in adults people are getting it. Even for them, unless you have breathing issues, we should not be doing CT scans. So please don't expose again your child to unnecessary radiation just because they got COVID. COVID is just another virus for our children. Yes, it is impacting a lot of systems, but let your doctor take care of that instead of you unnecessarily worrying about it. What I also wanted to know, wanted parents to know, is there's something called monoclonal antibodies that has come in in Indian market. So what is that? It's basically neutralizing antibody. These are a pool of antibodies. So if I get infected, my body generates antibodies that helps absorbs the virus, okay, so that we do not have those symptoms. So these are pool of antibodies which are given to a patient through IV cannula or subcutaneous injection, so that they can fight the infection and they do not go worsen to the where they might go into ICU, or it's also preventing hospitalization. These monoclonal antibodies have very, very specific indications. So they have to be used within 72 hours of developing the symptoms, and they are used only in high-risk patients. So people who are obese, who have, like how Mr. Christopher was saying, most of these patients who got little sicker had some underlying disease. So if they have heart disease or diabetes, any other renal issue, they're transplant children, these are very good candidates for these monoclonal antibodies. So if you have or you know somebody who might benefit from these monoclonal antibodies, just ask for. It's a combination of two antibodies. It's through Roche. You can ask your doctor about them if there is a candidate for it. For now, it's just for 12 years and older and more than 40 kg. But again, should not be given in patients who do not have these underlying issues. Third thing which I really wanted to focus on was what I am seeing, who got sicker. It was mostly children who were obese, who were overweight. Those are the kids mostly who ended up needing oxygen and getting admitted in our ICU. And with this pandemic, and for the children not able to go outside, play, work out, definitely it's going to be another epidemic for Indian society and across the world. So please, as parents, try to have your child engage into some physical activity. There are these YouTube channels, YouTube videos, do some family workout time, Zumba, dancing, yoga. This is our new normal. So we have to work around and get our children to healthy lifestyle, avoid processed foods. So again, please take care of your child's health, because it's the obese and overweight children which we saw getting way sicker than the healthier children. And before I start taking questions, all I want to say is, yes, the world is not going to be the same ever again, and we'll probably be seeing these kind of breakouts more frequently than our ancestors saw. But we have an opportunity to build a better one, being more conscious about our health, about nature, and take this opportunity to follow appropriate lifestyle. And definitely, even if our numbers in our second and our third, fourth, fifth wave are not that high, if they don't be high, please still follow COVID appropriate behavior, because that's the biggest saving grace, and it's the cheapest saving grace. So don't travel unnecessarily, wear proper mask, and maintain hand hygiene. We cannot give up these till this pandemic is under control. And hopefully, with vaccinating so many adults, our children will still be at a lower risk, because we know the most likely reason they got COVID was from that adult. So hopefully with this vaccination drive, our children would be in a better state. So I'll end here what I wanted to speak, and I'll start taking questions.
Thank you, Dr. Chaudhary. I think you laid so many demons that the parents had to rest, and you also killed the media monster. And you spoke, yeah, you spoke to our level, you know, layman language, and we're so fortunate to listen to you. And I think now we're equipped, if not as good as you, but good enough to take this forward in case we come across some situations. So thank you, Dr. Manu. And now we'll go to the questions. We've already collated several here. I'd like to start with questions that our principal, Mr. Christopher Anthony Brown, put together for us, and then we'll move on to questions that the parents have sent.
Sure.
So I have 7 questions that he has put together. They're very relevant and thought-provoking. I thought we could start with that. So the first question is, it has been announced in the social media that remdesivir is not recommended for children. Is this true?
So, the trials which we saw of remdesivir was mostly adult trials, okay? We have used, as an ID physician, I have used remdesivir for children, but there's again very clear indication. Remdesivir is used within 10 days of developing symptoms in a child who's needing oxygen. These are unless the child meets these 2 criteria, you cannot be using this antiviral. And even in those situations, the studies from some of the trials, there was a solidarity trial through WHO across the world, the benefit was not very, very clear. From my personal experience, we have used it and we have seen positive reports. So, and we follow some of the guidelines from the Infectious Diseases Society of America and AIMS protocol. So let's see how it's going to pan out. I know this recent update about not using remdesivir in children. We have some positive benefits. So I think it's going to be an informed decision between the physician who's very well equipped managing such patients and the family members.
All right, Dr. Chaudhary. So it's more on a as needed basis, and
Yes,
the pediatrician should know.
Yeah.
And of course, Rainbow Hospital, who specializes in all these, should probably be the place where we can check if we have any doubts, even if the pediatrician suggests that it's good to go to an expert.
Yes. And these kids, it's an intravenous medication, and this is only given in the hospital setting. There's specific.
Great. So we will have to go there anyway. So that's good. So the second question is, kids 5 years and below don't need masks. Is this true, and why?
So it's not 5 years, but 2 years. So 2 years and younger is just very, actually, I've seen younger children also wearing and being compliant, but the concern is them understanding how to keep it properly. Some of them are going to play with it, touch the front, touch everywhere. And then they have those loops. If they choke on it, if they bite it and they choke on it. So there are a lot of hazards related, and the loops and all, sometimes they can really strangulate and all. So these are some of the reasons we are suggesting not to use mask in children younger than 2 years. Children more than 2 years should be taught how to use a mask properly. And what I tell my patients' parents is, if they have a favorite toy, why don't you get a simple mask handmade at home or with a paper cut, and just make that soft toy as well, wear it. And as parents, if you demonstrate, they are very, very smart children. They'll follow it. They actually, some of the patients, they'll come and tell me that it's our child who reminds us. Every time we step out, they'll tell, where's your mask? So very smart. So teach them how to use it properly, how to hand hygiene after removing it. And then, yes, younger children, less than 2 years, not suggested because of all these choking hazard problems.
Yeah.
Dr.
Thank
Manu,
you.
a related
Yeah.
question before Raghavendra jumps into the next question. I think some parents are asking on the chat box, what is the kind of masks that you recommend children should wear, um, to handle this pandemic?
Sure. So a good triple layer mask, it can be a surgical mask, it can be a cloth mask. A good triple layer mask, which can give a good seal around your nose, covering your cheek, okay? And it should not be loose and it should not be falling down, is good enough. If there is, the N95s that are not designed for young children. So it's all adult. So maybe an adolescent can use it. That too, if you have a family member who's isolated and has COVID. So if you're visiting that room, then they should be wearing N95, and a child should not be visiting that room irrespective. So a good triple layer mask is what I would suggest. What happens with surgical mask is you have to discard it. You can't reuse it. So usually what I tell parents is have 7 good fitting mask, cloth mask, triple layer. Use them every day of the week, one particular mask, and wash them. And when you wash them, just dry them nicely in sun or somewhere it can kill the microbes. And that's pretty much you should be doing.
Thank you.
All right. Why is it suggested that no steroids be administered to children?
So steroids have, again, very, very clear indication in children. And if any of your doctors are giving it to your children, question your doctor. The indication is if the child is needing oxygen and they are proven COVID, that's when we are using steroids. So we are using steroid in children, but again, just for this indication. The second indication of steroids in children is if they develop the syndrome I told you, MISC, and the dosing is totally different. Okay, so dosing is totally different. Both these settings, the steroids will be done in the hospital. So if you are needing oxygen, you will be in the hospital. If you have developed that condition, you will be in the hospital. Just based on blood test and high-grade fevers, your doctor cannot give steroids at home. There should be very clear indication for steroids because it can, short duration steroids don't really cause that much of pain, but longer duration of steroid can affect a child's growth. So would definitely question if somebody is using steroids in OPD.
All right. There's a related question here. What's the preventive? Is there any preventive medicine for children?
So no, so there's no medication that is going to prevent this infection. What is going to prevent this infection is the COVID appropriate behavior we all have been alluding to. Second is a healthy lifestyle. So that's why the figures the reason I gave you that figure of why more obese patients are getting ICU admitted and needing oxygen is this is the reason. I want you to work on your child's health. So fresh, local produce in their diet and some workout as a family, all together in the limited space is what we have to get used to. So if we take care of those 2 things, I'm sure your child will be protected.
All right. Talking of fitness, what's this 6-minute walk test for children below 12 years and where can it be done?
So 6-minute walk test is basically you take the oxygen of the person and it's for everybody, mostly for adults actually. So you take the oxygen levels before you do the 6-minute walk and then you walk for 6 minutes on a plain surface and then you recheck the oxygen end of 6 minutes. So if there's a decline in your oxygen by number 3, or it's to begin with, it's less than 93, 95 for common man we are saying. For us, we say 93. So less than 95. That means your oxygen level is low and you need to see a doctor. So it's just an early sign to catch on to seek medical help. But we are not regularly telling our parents to do this test. Even when they have COVID, we are not telling them to keep doing it every day. It's more of watching out for those respiratory issues like, breathing difficulties, chest moving in and out. And if those are the concerns, then they come in. But for adolescents, we can definitely do this test.
Yeah, it looks like another good sounding media hype, this walking test. Anyway, so thanks for putting that down. Okay, here's a generic question. Are you aware of the government guidelines to manage COVID in kids? And where could I get a copy of this document?
So you can get access through Ministry of Health and Family Welfare. So it's a beautiful website through Government of India. It has videos, informative videos for public, exact numbers of how many COVID infections have happened, vaccinated, where to get vaccinated. All that information is on that website. So Ministry of Health and Family Welfare. In that, you have section for doctors, which is open to everyone again. And that's where you can access these guidelines.
Yeah, thanks for that specific
Could
information.
you repeat that,
because
ma'am, for
once we
people
go there,
who may have missed out?
I'll just type it. I can take next question.
Okay. Vaccination for 12 to 15-year-olds has commenced in the West, but it is being argued that it is more important to completely immunize the 18 plus first here. Why?
So the vaccine that is available in US is the Pfizer vaccine below about 12 years of age. There have been cases where, temporally, in some areas, what they saw after the vaccination, that there was some inflammation of the heart. So still we haven't proven it as a causal reason that vaccination caused it to them. Okay, so because we don't, there isn't great information yet to tell us what is the usual incidence of inflammation of heart in that area. Okay, so but they have informed this Center for Disease Control is their big organization, which informs about all these events to the pediatricians, so that they are aware that if a child is presenting like that and if they've had vaccine, then look out for this symptom. So it hasn't halted the administration of the vaccine, because we still don't know if that's what it really caused. Okay, in the vaccine through Pfizer requires minus 70 degrees Celsius to store it. Okay, so that's a very big limitation to use that vaccine in India, because it's a huge country and the cold storage is a big challenge. But I still feel with our great setup, we should be able to weigh in these vaccines, to route these vaccines to India. But there's a lot of paperwork that goes on in with it. So all litigations and who is going to be responsible when things don't work out the way they should work out. So all that paperwork is still going on. What is happening for vaccine in India for children? So the co-vaccine, so Bharat Biotech, when they did their trials in adults, they had a subset of patients who were below 12 years of age. Who were above 12 years of age, but below 18. So they had some children in their subset where they did not find any adverse effect. And there are ongoing trials. So around May 10th is when they started their trials in children in India. So 2 years to 12 years. So the trials are already started in India. And with good data in adults, I am speculating in another 1 or 2, 3 months, we should be seeing these vaccination available in children in India. So that is what my suspicion is, not suspicion, but speculation about vaccination coming for children. Right now we are seeing, unless we have those studies and those numbers and ensure that it's not causing any serious side adverse, we have to wait. I would not suggest getting children below 18 years of age getting vaccinated. So I think the focus should be getting everybody vaccinated above 18 and watch for the studies available for children.
Yeah. So the next question from Sir is similar to what you just said. Insofar as COVID-19 is concerned, it is said that no one's safe till everyone's safe. Could you explain that, please?
So that's true, right? So what happened with the transmissibility of this virus? Even if a person, and the other warning thing, before I dive into this answer, even if you're vaccinated, you can still be an asymptomatic carrier of the virus and spread it. So just because you got vaccinated doesn't mean you don't need to wear a mask, because you have people, you have children, you have people who cannot get vaccinated because of their underlying disease, that you still have to wear a mask around these subset of high-risk patients. So, and that's why even this quote goes, right? Till everybody's protected, you still can't feel comfortable about it. And that's what we have to take care. Even when all our adults are vaccinated across our country, we cannot become lax, because we still have these children who are unvaccinated. We'll still have pregnant females who are not vaccinated. We'll still have immunocompromised hosts like organ transplant, bone marrow transplant, or any other chronic illness who didn't get this vaccination around us. So
okay, doctor, then could we say that is probably the reason why they are not reopening?
Absolutely. Okay. And school is children, right? It's mostly children. So till we protect our children with a vaccine, I think pretty hesitant, government will be pretty hesitant to start it. So in US, what they have done is, because my nephews are studying there, so even in younger children, they've opened up the school, but what they do is they've divided the class in two. So it's half the children will come on one particular day. The duration of staying in the class is again half of what the normal school used to look like. They do not do their recesses in the school. They come in, they study, and they go back. The social distancing is there in the class. All the teachers and caretakers who are in the school are vaccinated. So they are opening very gradually, in a graded manner, and something probably once we have our adults and teachers and caretakers in the hospital vaccinated, I think that is the way you guys can go ahead again. But I don't think we can open it just, it has to be a graded approach.
Okay. Thank you, doctor.
All right. So now we can move on to the specific questions from parents that we've received. The first one is, are there any specific child-related medical facilities like ICUs, pediatric ventilators, etc., in our hospitals?
Yes, absolutely. So I had informed you guys that Rainbow Children's is dedicated pediatric hospital. So we have ventilators for newborns, and we have ventilators for adolescents and toddlers. So there are these facilities available in Rainbow Children's Hospital. Most of the multi-speciality hospitals will have a wing for pediatrics, and they do, and even our government hospitals, they have a wing for pediatric population, and they have all these supports. And we have to remember that very few children, even with such a huge pandemic, second wave, very few children needed these ventilators, and we didn't fall short of it. So with third wave, which will probably be way lower, and with most family members being vaccinated, that again, the need for children needing ventilators will still be low, way lower than what I suspect we saw in second wave. So yes, these facilities are available in India. It's not like we're pretty well developed in that regard in care of health, in case of health.
Wonderful. The second question. Adults are giving multivitamins with zinc and vitamin C to their children to keep away corona. Do these supplements really help the children?
So, there are kids who are picky eaters. So in those kids, I do suggest for those 2 weeks when they have COVID to do some multivitamin, which is fine. I am very pro for supplementing iron in less than 2 years of children, and then with not enough sun exposure because of decreased outdoors activities, vitamin D. Again, these should be prescribed by a physician because there are different strength of vitamin D, there are different strength of these multivitamins, so should be under prescription and not over the counter. I have seen, a lot of adults were just popping in these vitamin C tablets. So we've seen stones, kidney stones happening because of vitamin C. The vitamin D is metabolized by your liver. So if you take overdose, it can actually cause liver issues. So don't hog on it. Don't force your children on it. If they are eating good citric fruits, healthy diet, all they need is probably a maintenance vitamin D dose. And if they're younger than 2 years, then iron drops. That's it.
Raghavendra, I'll just step in here.
Yes.
Since we're on the topic of medicine, I think some parents also have a doubt, or they want to ask, what is your view on, prescribing homeopathy or Ayurvedic medicines as preventive or as a cure for getting COVID?
Sure. So Ayurveda, definitely, it's a science. It's mostly a preventative science, we all know. We've grown up with it. So I would definitely recommend, even for kids, even before this COVID, if a child would come to me below 6 years of age who have throat pain or cough, the most important thing is keeping the throat lined by something sweet, so it doesn't cause the itchiness, scratchiness. So I would tell them to do honey, tulsi, whatever we grew up with, and it's actually very helpful. Turmeric is known for its anti-inflammatory benefit. So turmeric with milk is okay, but overdoing it, I don't agree with. Homeopathy is not a science, so I'll apologize to people who believe in it and who practice it. But as a physician, I do not agree with it. So don't overdo anything is what my suggestion would be. Simple Ayurvedic processes we should follow. We know the benefits of it as growing up. Lukewarm water with honey, all those things, turmeric milk, it's fine, but don't overdo it. If your child is not enjoying it, don't force them. Steaming every day, oh my God. So we had at some point a couple of children coming with burnt, and then we found out what happened was they're totally normal children, they do not have COVID symptoms, and parents are trying to give them steam every day. Not recommended. So steaming is not recommended. So please don't do it for children. Just supportive care, some saline nose drops, is more than enough. If they're older children, they know how to do it. It's totally fine if they're symptomatic. If they're not, please don't force them to do that as well. We actually had, 2 kids came in with liver failure because they took some homeopathic, cocktail to prevent COVID to happen in, next couple of months. So we had liver failure because fortunately the child made it and the liver recovered, but there are times when they don't. So please do not use unprescribed medications or Ayurvedic management.
Doctor.
Okay. We will go to the next question. If a child is hospitalized, will a parent be allowed to stay with the child inside?
Absolutely. So a child cannot be left alone, right? So if it's a younger child where just one parent is not able to handle, right? If she or he is going to the restroom and the child is alone, we can't do that. So if it's a younger child, we let both the parents take care of the child. If it's an older child, we have one of the parents stay with them. So you will be allowed if your child requires hospitalization.
Yeah, so that should allay some of the fears because we had heard results that for adults, they are on their own. Okay.
So a related question, I'm sorry, Raghavendra, one second.
Yeah, yes,
a related question to the same topic. you have answered, from the other side. What if a parent in their homes get COVID? How should parents deal with children? Can they still interact with children, or should they try and keep them separate? What is your view on that?
Sure. So definitely very good question, because we really encountered this in this wave. So if the parent is COVID positive, very much likely the child is already exposed. Okay. So I tell them not to, if it's a very young child who's breastfeeding or who's a toddler, please do not separate that child from the mother or the parent who has COVID. I tell them till they are symptomatic, please wear a N95 mask when you're breastfeeding or you're taking care of that particular your child. If possible, when you are sleeping, have your bed at least 6 feet distance from their crib or bed, and have good ventilation. So if you can open your window, continue using your, fortunately, Bangalore has beautiful weather, but if any hotter area, just switch on the fan, switch on the AC, keep your window open so that the virus is not circulating inside. If you're breastfeeding, clean your breast, clean your hands before breastfeeding and after. And once you are 10 days after your first symptom, you're overall recovering, you're afebrile for 24 hours without fever medicine, you are very less likely to spread that infection to your child. So
can you repeat that last statement, ma'am, slowly, so that everybody can hear? It's very important. So that's why I'm asking to repeat it.
Sure. So for now, we were saying isolating for 14 days, right? So now we know, if you are if you are 10 days beyond your first onset of symptoms, so that first onset of symptom could be fatigue, could be a little bit of runny nose, could be a little bit of fever. If you're 10 days beyond that, and because some parents and some adults, they count their symptoms only when they get very sick, but you have to count from the first symptom. You're 10 days beyond it, you are not needing fever medicine to bring down your fever for 24 hours. You are not needing oxygen for the last 2-3 days. That means it's very less likely that you're going to spread that infection to anybody else. Okay, so if you are in that period and you are feeling better, you can take care of your child, and you can actually take care of your child even when you are symptomatic. You just have to ensure you're wearing a proper mask and maintaining that distance. Please don't send your children to your neighbors, to other elderlies, because it's just, you're just exposing the new set of people you're sending your child to. And the child will probably do fine, but those elderlies or those people may get way sicker than. So it's a very sad situation. So the first question was if the parent is positive and the child is negative. So they stay together but maintain the COVID appropriate behavior. If they can sleep in separate room, that would be great, because that decreases the exposure time. If the child is positive and the parent is negative, so that's another situation, right? So if the child is, and the child, it will be very difficult to keep your child in mask all the time. So again, the parent will have to wear a mask till your child is better. So you can, if they can't sleep alone, you can sleep with them, try to sleep at a distance. Maybe you can put them to sleep and then go to another cot or a cot just next to the room so that they feel safe that we have somebody. If it's a adolescent, then you can keep video calling with them and they'll understand, but don't leave them completely in a very segregated area. There was a lot of concern about AC also, if AC increases this. So if there is a centralized AC and there are air exchanges more than 12 per hour, there's very less likely chances it's going to spread anywhere. But most of the homes in India have split ACs. So every room has its own unit. So whoever has COVID and they're staying in one particular room, they please can use if it's hot, use your AC. It's not like they're going to spread it to another room because they have their own separate
exhaust.
Yeah. So those are some of the things to look out for. Yeah.
Doctor, I made an appeal to some of our participants today to let us know if they've had a personal experience, especially if one of their children had COVID. So that they could share their story, and it would be so helpful to everybody else. I was so happy that I didn't even get one response, which just goes to tell me that I think things are getting better.
Yes.
And my God, I only hope that we can get our children back, because I can tell you, I stay on campus, and the one thing that I miss are my children.
Absolutely. And I'm sure they're missing you guys too. I think this is not normal for them. They're seeing a lot of psychosocial clinical conditions also coming to the OPD, where, you know, they have abnormal behaviors, they're throwing a lot of tantrums if they're younger, sleep disorders, aggressive behaviors, habitual cough, because they've heard of, that's what COVID does. Or if they're recovered from COVID, even in children, we are seeing this long COVID symptoms where, 6 to 12 weeks after they've recovered COVID, they're still, circulating those thoughts of being fatigued, being tired, not feeling well, muscle pains, and habitual cough develops. So it's just unfortunate. And I just hope things get better gradually.
Yeah, that's what I always maintain, that coronavirus is a very wicked virus. More than affecting our bodies, it's affecting our minds.
Absolutely.
And it's turning worse by the day. And I am sorry to say the media is not helping us one bit. They should spread positive messages rather than being
and I think as a Mother Earth has really had it. So I hope, and I'm sure a lot of, being in education, I'm sure you guys are drilling in the importance of nature and how to be taking care of nature is so important. And I don't think this is it. We're going to have a lot of such issues, and I think we'll have to get used to new normal and follow new protocols, and just be prepared. I don't want to make people sad. It's just being prepared is very, very important.
Raghavendra?
Okay, sir. Go to the next question.
Yeah.
It has 3 parts to it, actually. In what circumstances are newborns prone to getting COVID? Can it spread through the newborn receiving feed from the mother? Are pregnant women more prone to getting COVID?
Sure. So ours is also a mother and child hospital. So I did take care of these mothers and newborn pairs. Out of, I would say, around 500 patients, such couple died I've seen. Less than 1% the newborn got affected with COVID. And that too was very mildly symptomatic. Very few needed ICU. So can the newborn get infected? Yes, they can, but very rare. Reason being, we were very strict with the mothers regarding using N95 mask when they are feeding their newborn, cleaning their breasts and hand hygiene before breastfeeding, keeping the crib away. The other option we gave to these newborn mothers was if they can pump and give that milk, and some other unaffected family member can feed the baby. But it's very important for that newborn to bond with the mother. So skin to skin care and all those things are very important. But if she's wearing a good N95 mask, the newborn is taken care of. Second question was, are pregnant female more prone to getting the infection?
Yeah.
They have the same possibility of getting infected, but they can get more sicker than a non-pregnant adult. Okay, so they're actually 26 times higher chances of pregnant female getting more sicker. So that's why we have to really take care of. For now, the lactating mothers are, per Government of India, allowed to take the vaccine. They don't need to stop breastfeeding before or after the vaccine, so they can continue breastfeeding. It will actually be beneficial, because when they develop antibodies, they're going to give it to their newborn as well. So that would be great. In regards to pregnant females across the world, there has been informed decision making between the OBGYN and the pregnant female to get vaccinated, because the trials are still very few trials in pregnant females and how it can impact the newborn in the womb. But still, because of this high risk, a lot of these bodies, so ACOG, so American College of OBGYN, RFOXC, they say it should be an informed decision making. So there are pregnant females who are choosing. But Government of India for now is saying no to pregnant females. So it's more of a decision making between the OBGYN and the pregnant female. But we are seeing pregnant females needing oxygen, needing steroids, needing remdesivir because of this infection.
Right.
And then lactating mothers can spread it, but if they are wearing their mask properly, very few cases. Like I can count on my fingers.
Yeah, so that's good news. Okay, next one. Are there specific types of masks exclusively to be used by children of different age groups? I think you've already answered this.
Kind of, yeah.
Yeah, okay. Next one. What's the post-COVID protocol for children? What is long COVID that we are hearing about?
So briefly, I talked about it. So post-COVID protocol is trying to, I think there's been a lot of stigma attached to this illness. I think we just have to understand it's another virus for children. And they will recover. Most of them will be fine. So this is exactly what you have to tell your children. It's fine, you'll get better, just like how we got better, or how that uncle got better, or that friend of yours got better. So that would be the message to them. Post-COVID, long COVID, exactly like just like adults, how they are having all these heart palpitation, muscle pains, headaches, myalgia. They're having cough, chronic cough, even when they have improved. So we are seeing in some adolescent those symptoms. Most of the time, the care is more of psychosocial support than really a medical support in these patients.
So, related question, doctor: is it required or is it mandatory for adults or children, for that matter, to get a second test after the period that you prescribed, the 10 days plus or minus 2 or 3 days of non symptoms? Is it mandatory for them to get a second RT-PCR?
Not at all. So Government of India says not at all repeating tests. And the reason being, because it's a RT-PCR, so it's reverse transcripts, just complicated. Basically, what it does is it picks up the DNA material of the virus. So you can have dead virus in the body and they pick it up and then they say, oh, he's still infected. And that is the reason, in our previous wave, we heard all these stars also having repeated tests for months being positive. So that is totally scrapped off. We do not repeat tests to tell us one person is negative. Very selective situations we are repeating tests. One, where we are still confused about the diagnosis. Two, if they are very severe COVID who needed ICU, just to understand and for mobilizing them within the hospital. Those are the only two situations where we're doing these repeat tests, but it is not indicated anymore. And if somebody is forcing someone to get it tested just to rejoin hospital, school or whatever, then they can go to the Ministry of Health website and quote, they have this guideline there.
Okay. Thank you.
Doctor, I have one question. A lot of, at least from what I heard today, there are 31,000 cases of black fungus and over 2,000 fatalities up to date. And is there any relation between the black fungus and the COVID patients? Because I think most of the black fungus cases are those who are recovering or have COVID. Is that true?
So India is the capital of diabetes. So what we found out was all this so far. So one is diabetes. Second is poor sugar control. So people don't even know they have diabetes. And the first time they're finding out is because of COVID. So they have poor sugar control. The same receptors which are there. So the high sugar increases some particular receptors. It's the same receptor through this fungus also attaches. Okay, so that with our loose soil, India in itself has high spore. So this fungus is in the air. We all are breathing it. We are fine because we are good host. We have immunity. This high spore content. So all those together put together is the reason we are seeing this fungus. And actually, this fungus in the lab doesn't even look black. It actually is white. But what it does to the body, that looks black because it kills that area. There's a lot of necrosis, the medical term for it, and that looks black, and that's why the name black fungus. Right. So yes, we are seeing, and it's not the first time we are seeing this infection. So in our immunocompromised host, cancer patients, transplant patients, we've managed this fungus before. So I am quite well versed with managing those cases. What is new now is the number is way higher. And the reason it's way higher is the misuse of steroids. So people are giving steroids, but they don't know exactly when, how much, how long. So there's misuse of steroids, which increases the sugars in non-diabetic patients, which makes the balance of sugar to control sugar well in diabetic patients a challenge. And with this COVID, already low immunity of the body, it's very easy for this to grow. So that those are some of the reasons we are seeing. But none of the children I've seen so far.
Thank you.
Most importantly, none of the children.
Yes.
Yes, and that's what I've learned from this. I've done a lot of research, and the best thing I learned was that the babies are spared.
Yes.
Yeah.
Few cases, I mean,
that would be good.
Like I will not say people to put their cards down. That
no. That was in my message.
Yes.
And we can't afford to do that.
To panic. There's definitely no need to panic about third wave or overall.
Yeah.
Raghavendra, you can ask the next question.
Yeah, it has two parts to it. Is the Pfizer vaccination presently rolled out in the West useful against the Indian variant? And will corona vaccination become an annual feature?
Sure. So all the vaccines, even Covishield, which is Oxford AstraZeneca, the Pfizer, Moderna, which are mRNA, their particular type of vaccine, and Covaxin, there are studies which are going on in the lab to find out how much immunity will it give to Delta variant, which is our B1617 variant. All these vaccines do protect us against this variant, but the ability to generate the efficacy is it's not way lower, but lower than what the previous strains have been. So it is protecting, but to the lesser extent. Hopefully, maybe with boosters, as you said, would it become a yearly event? Possible. So maybe with new studies, we will know if doing one vaccine and then changing the brand, or after 6 months to 1 year getting another vaccine booster, maybe those things will help. But again, time and studies can only prove that.
Yeah, too early for that then.
Yeah, but it is protecting against the variant, in simple words.
Yeah, someone was saying the other day, like, these are all cousins, so you can still see the resemblance, so you still get the protection.
Yes.
Okay. Some parents want to go to Dubai, America, etc., to get their children vaccinated. What's your message to them?
So traveling during this time, you are exposing your child to the infection. So what I would suggest is, instead of doing this unnecessarily travel, I would just wait. Maybe in a couple of months we will have our own vaccine and you can protect your children, because exposing them to airports, going to a new country, and then going to their hospital, you probably are exposing your child. Yeah. So I would wait for our own vaccine.
Yeah, I think they should think about that risk factor. It's so huge.
Yeah.
All right. Once the school reopens, what are the SOPs to be followed for the safety of the children?
Just briefly, I talked about it, right? How the other countries are doing it. We'll probably need to break the strength of the class, get all people vaccinated who can get vaccinated, and then avoiding recess and spacing out the seats and ensuring good mask behavior. So probably those are the guidelines you'll have to go through.
Sure.
If I may step in,
Yes,
Raghavendra, I think for the paucity of time, I think we may just want to move ahead. We're already we've done a few rounds of questions, and these questions can keep coming endlessly because there's so many more that need to be answered. But before we end the Q&A session, I think if I can take the permission of the audience and ask the last question, and what are the preventive measures? If you could just repeat, I know you have stressed upon it through the rest of the webinar, but if you can just repeat, what are the preventive measures that one can still continue to take to ensure that the children at homes don't get COVID? I think we can probably end on that note and then take the next part of the webinar.
Sure. So COVID appropriate behavior, and we're going to hear this term a lot. First is proper mask. It should be covering your nose, your child's nose. It will be well fitting. It should be triple layer. Actually, with this new variant, double masking is also suggested. The concern with double masking from my end is if you're not wearing even one of those masks properly, you're just making yourself at high risk. Second is hand hygiene. So definitely don't go crazy about it, but ensure you're following it. And then social distancing. So if you're going into some area where there might be a little bit of crowding and more than a couple of people, maintain that 1 meter distance. As adults, yes, you might be vaccinated, but as I told you, you can still get mild infection. So we had people who had mild infection even after vaccination, not unheard of it. The vaccine is giving us protection against severe COVID, but you can still get mild and moderate infection, especially with Covaxin. We are seeing more numbers. So just because you're vaccinated doesn't mean you are protected against it, and doesn't mean you are not going to spread it. So till the child is vaccinated and your other family members are vaccinated, please follow COVID appropriate behavior going forward. Eat healthy. Please integrate healthy lifestyle. It's easy to say, it's difficult to do, but it's definitely need of the hour. So do that. If you have any concerns regarding your child's health or your health, reach out to your doctor earlier than later. Very simple medications for managing children at home for COVID is just fever medicine, hydration with ORS. There are these Tetra packs, keep them handy. Mild cough, cold, you can take anti-allergy cough medicine. Really don't have to, give unnecessary antibiotics. So those are some of the points I would convey as a physician.
Thank you very much, Doctor.
Thank you, Doctor, for those takeaways. I think coming at the end, we will remember and do that. So I now invite Head of Admissions, Ms. Tracy Menzel, to deliver the vote of thanks.
Good evening, ladies and gentlemen. No duty is more important than that of returning thanks. On behalf of Redbridge International Academy, I take this opportunity to propose a vote of thanks to those who have directly or indirectly contributed to the success of this webinar. At the outset, I would like to thank our guest speaker and resource person for the evening, Dr. Manu Chaudhary. Ma'am, I would be failing in my duty if I did not place on record and express my deep sense of appreciation to you for sharing your knowledge and the clarity with which you addressed and explained all the concerns and apprehensions that have been of very great concern to our parents and others in the audience this evening. We are all very grateful to you, and once again, sincerely thank you for making yourself available despite your very busy schedule during these rather tiring times caused by the pandemic. We thank our chairman, Mr. Rohan Agarwal, and principal, Mr. Christopher Anthony Brown, for visualizing the need, the relevance, and the importance of this webinar and getting it organized so efficiently. We also thank you for your eloquence and inimitable style of delivery in each of your addresses, which threw more light on the subject of this webinar. A special thank you to the organizing committee, our compere, Mr. Raghavendra Ashok, and the administrative and teaching staff for their support and excellent coordination. Our heartfelt thank you to all the parents and well-wishers for their active participation. Now, before we bring down the curtain on this very successful event that was specially organized for the benefit of our children, I would also like to remind you of yet another important program that the school has organized for the beautiful children who are not as fortunate as ours, the less fortunate of society. This event is called Donathon. We seek donations from the public in terms of books, clothes, toys, etc. And this would be distributed among the less fortunate children of our society. Now, without further ado, I leave you with a short video that will throw more light on the event Donathon. Thank you.
Over 2 million children live on the streets, with no shelter, no healthcare, no education, and no proper meals. Redbridge International Academy brings to you Donathon, an opportunity for you to bridge the gap. Donathon is a unique initiative to reach out to these children in need by being a bridge between the privileged and the underprivileged. This drive focuses on collecting your generous donations and donating it to the needy children. Your donations will help to facilitate their education and help them to become good citizens. Donate what you don't use: clothes in good condition, linen, textbooks, toys, and other things that you have no use for. But these things are a distant dream to the underprivileged. Let's put a smile on every face.
Thank you, Devraj. Thank you, Dr. Manu, for all the help and support and answering all our queries. It was a very informative webinar indeed. Thank you so much for your support. Thanks a ton.
Okay, guys, stay safe.
Bye.
Stay healthy. Yeah.
Thank you, Doctor.
You're welcome, Rohan. Thank you. Thank you, Rag.
Thank
Yeah.
Thank you, Doctor. Thank you very much.
Thank you. Thank you so much for calling me and sharing my knowledge. I'm very happy.
It was a pleasure having
look
you.
Forward
Doctor.
to having you with us again sometime soon when physical classes also start to address the parents. I think there's a lot of work that needs to be done after school start as well. So we really look forward to associating with you.
Absolutely, Rohan. I look forward to. Take care, guys.
And ladies and gentlemen, I forgot to mention, on Yoga Day this month, we are planning another special webinar. So please look out for that. That's on the 21st of June.